Good day, ladies and gentlemen. I am tasked today to discuss to you about on how to insert IV cannula. Before we start, I would like to introduce myself. I am Mr. Alsaudi Lakibul, a registered nurse, and I am a clinical educator in the emergency room. I will be using audiovisual presentation as a teaching strategy. Let's start. We will begin with the definition. An intravenous cannula is a flexible tube which, when inserted into the body, and is used either to withdraw fluids or insert medication. Cannula normally comes with old trocar, a sharp-pointed needle attached which allow puncture of the body to get into intended space. The purpose of IV cannulation. Number one, for administration of intravenous injection. Number two, for the administration of intravenous fluid. Sometimes nurses, when the nurses is inserting the cannula, they already withdraw blood and send it to laboratory for blood investigation. We move on to the cannula sizes. We have gauge 26, the purple one, the yellow one, which is gauge 24. These two cannula normally uses for pediatric patient. We have gauge 22. Gauge 22 can be used for adult as well as older pediatric patient. We have gauge 20 and gauge 18. It is most commonly used for trauma patient, and also for blood transfusion. We have gauge 16 and we have gauge 14. The color red, the gauge 16 is the color gray. Next, we have the parts of the IV cannula. This one is the threaded stopper, the flashback chamber rather, the needle hub, the needle. This one is the wing main body, the non-return valve, the port cap, the Teflon, and the needle cover. This one is the Teflon holder. Next, we have the materials needed when inserting RV cannula. We should prepare a tray containing of surgical gloves. We need also, of course, the IV cannula, a tourniquet, alcohol swab, Tegaderm dressing, IV extensor, and lastly, the saline flushing to determine the patency of our cannula. A vein. When selecting a vein, we should start from the distal part, from here up to here. We need to avoid the joint area, avoid the site closer to the infected area or any fracture, area having shunt, the patient with having a AV fistula for a patient who was having dialysis, and avoid the lower extremities in adults to prevent a deep vein thrombosis. How to insert IV cannula in a proper way. I will show you a video on how to insert IV cannula. Let's start. As what I've said earlier, we need to gather the equipment, the cannula dressing, alcohol swab, saline flush, a gauze, tourniquet, IV cannula, extension set, and lastly gloves. Don the gloves first and then prepare all the set on the field. Prepare the saline flush or prime the extension set. Position the patient arm and inspect for a suitable vein. Apply the tourniquet, palpate the vein gently, disinfect the skin for 30 seconds and allow it to dry. Do the hand hygiene and then another gloves and then prepare the IV cannula. Aim the vein from the bottom and insert the IV cannula at 10 to 30 degrees angle. Once there is a backflow, it means that you are already inside the vein. Withdraw the needle a little bit and advance the IV cannula inside the vein. Remove the tourniquet, remove the needle, and discharge it on the proper waste disposal. Attach the IV extension, secure the cannula, check for the patency of the vein and ask the patient if he or she is having pain. And lastly, apply the cannula dressing and label it with the date of insertion. Aftercare. Replace all the articles that you used during the insertion. Dispose of the disposable article as per hospital policy. And lastly, record in the nurse's notes. That will be all for today. Hope you learned something about on how to insert IV cannula. Thank you, nurses. Good luck and welcome.